So just to give a brief outline of what I'm going to cover, firstly, what are we talking about when we say quality and qualitative research? I'll talk a little bit about some of the critiques of quality criteria, checklists, etc., and then go into what are some of the typical checklists, guidelines, and criteria that are used and promoted. So what is out there, and then how do we actually use these in our research? And we'll also give an example of how I've practically applied these criteria in one of our qualitative studies. And then, as I said, at the end, there'll be a list of all the resources that I've included here that provide a much more in-depth explanation of these issues. And I'm just going to make the pictures go away so I can see my whole slide. All right, so in terms of what quality in qualitative research is referring to, when I had a look at the literature, it was really quite evident that this has been a long ongoing debate. Many of the early papers were from 2000 onwards, so this is not something recent. It's really been going on for about 20 years. And how the argument is gone is that how do we then take some of the criteria that we use for quantitative research in terms of determining quality, and how can we use and apply these to assess the quality of qualitative research? So some of the typical or some of the early constructs that were mentioned in terms of quality were firstly validity, and some of the ways in which this is promoted in qualitative research is through triangulation, respondent validation, or member checking, a clear exposition of data collection and analysis methods, reflexivity, attention to negative cases, and fair dealing. Relevance is another criteria that came up early in the debate. And this is about how it adds to knowledge or increases the confidence with which existing knowledge is regarded, and also incorporating theoretical sampling so that as many factors affecting variability can be covered as possible in order to enhance generalizability. And I guess that word generalizability, for those of us who work in qualitative research, kind of sets off a little alarm bell, because many of us were taught we can't generalize our findings. So this starts to give you some sense of what the debate is around in terms of applying a particular way of thinking from quantitative research to qualitative research. Where can that be helpful? And where does that start to become problematic? And more recently, some of the quality criteria that are mentioned are credibility, transferability, dependability, and confirmability. And I'm going to go through those in a little bit more detail, but also just wanted to flag that reflexivity, which Nosipho will cover in much more details, is seen to be integral to transparency and quality. And this can be defined as the process of critical self-reflection about oneself as a researcher and the research relationship. And where did my arrow go? Okay, so credibility, this is the confidence that we have in the truth of the research findings. And the research findings credibly represent plausible information from original data, seen as the correct interpretation of participants' original views, and it's achieved through prolonged engagement, persistent observation, triangulation, and member checking. Transferability has been defined as the degree to which results can be transferred to other contexts or settings with other respondents. And this, I guess, makes us think of something like generalizability, where we're not thinking about it in exactly the same way as how we would generalize quantitative findings from a randomized sample, but it's the extent to which, how could that, some of the thinking behind that principle be applied through transferability. And a researcher facilitates transferability by a potential user through thick description. In dependability, this refers to the stability of findings over time. and it involves participants' evaluation of findings, their interpretation and recommendations of the study. And lastly, confirmability, and this can be seen to refer to the degree to which findings of a research study could be confirmed by other researchers. And it's also concerned with establishing that data and interpretations of the findings are clearly derived from the data. So what are some of the critiques? And I've included the references here and the years just to show that from early on, when these criteria and checklists were being developed, that these critiques were already coming out from the early 2000s. So one of the early articles talked about was the tail wagging the dog. In terms of these checklists and criteria, do those lists or elements of criteria, do they start actually then determining how the research is done? And Barber argues that this can be counterproductive, these kind of checklists and criteria, if they're applied too enthusiastically and uncritically, but they need to be embedded in a broader understanding of qualitative research. Carter and Little, a little bit later on, they said that epistemology, which they refer to as the theory of knowledge, methodology, the study of methods, and method, the research action, that should provide the framework for planning, implementing, and evaluating the quality of qualitative research. Sparks and Smith, who work more in the area of exercise and sports science, their article talks about criteriologists versus relativists. And they argue that a criteriological approach may provide a false sense of security because it gives us this idea that the research can be quick and clean and make our life easier as researchers. However, they argue that this lacks a solid philosophical foundation, and it can be inherently limiting and one-dimensional, and may then just simply impose its own preordained criteria on all forms of inquiry. So they tend more away from criteria and more towards a relativist position. Even more recently, Sandalowski says that these standards and the mindset driving them offer no language with which to speak about taste or the aesthetic sensibilities that play such a key role in evaluating the goodness of any object. And then lastly, an article talks about the Cobra effect, which I won't go into detail to explain what it means. The article explains it really nicely, but what it's referring to is when an attempted solution to a problem actually makes the problem worse and or creates other unintended problematic consequences. So they have some issues around thematic emergence, triangulation, saturation, and member checking. So this is just to say that as much as we talk about these criteria and these checklists and guidelines, there are some critical positions that evaluate this, and understanding then which of these guidelines or which of these checklists or criteria to use, it is really helpful, particularly as you are, if you earlier in your research career doing qualitative research or even further along, it's helpful to look at some of these critiques because I think they help to give more of a well-rounded perspective. That said, I'm going to share with you what some of these checklists, guidelines, and criteria are, just to give you a sense of what's out there. And part of this is because many times when you publish qualitative research, journals are increasingly requiring you to use one of these to indicate that you have followed the criteria, that you can report on. Some go as far as to say, which page do you mention X guideline, or you can tick off the checklist. So it is part of our experience as qualitative researchers to be aware of these. I think there is room sometimes to push back on this, given the critiques, where you feel that is pushing the research or the presentation of the findings in a way that doesn't accurately reflect or give a proper representation of the findings in the study. So from a bias perspective, I thought I'd start with the ones that I found the most helpful. So this is by Tracy, and it came out in 2010. And they referred to the 8 big tent criteria for excellent qualitative research. And I'm actually going to come back to these when I talk about how these can actually be applied. So in terms of how we use these, I guess the first question is, do we use these? So bearing in mind the critiques that I mentioned, Do we use them if journals require it? Do we push back on that? And I'm not going to necessarily give a hard and fast answer to that. I think what I found helpful in kind of going back and looking at these and looking at what are the various things out there, what are the commonalities, is, what are the criteria that are most helpful for a particular study when we're reporting on it? But not only that, but how can we actually integrate quality into our thinking, into our planning, and into our methods? So I think it is helpful to use these when reporting the findings of a study. And obviously there's different choices of what to use and what's required to use in particular situations. But if quality is only an afterthought when you're actually trying to publish the article, I think that then starts to make these critiques ring true, that they become kind of an uncritical approach to thinking about quality, versus if those are really just kind of highlighting the things that have been done already. So when we're planning a study, how can we think about these criteria? How can we think about, are our findings going to be credible? Are they dependable? Are we doing it in such a way that these findings can be transferred to other similar settings? I think for me personally, I think that's a more helpful way of thinking, so that when we do essentially a tick box exercise for a journal, those are things that we've already been thinking about, and then we've already placed value on. And when putting this together, I think what came to mind is, for many of us, we know that qualitative research can often be quite messy. And what are the things that get in the way of quality? Because I think for most of us, we don't start out a study thinking, well, let me do a poor quality study. I think we start out with aspirations of doing something that's high quality, but often there are these various things that kind of are hurdles that we have to jump over and that can really hinder promoting quality in our qualitative research. And so these are just some of the things I've listed. So in terms of funding, sometimes not having funding available to do, for example, going back to participants and getting their feedback. Sometimes there's not enough funding to do as many focus groups or as many interviews, or to say do them across as many settings. For example, saying we want to compare urban and rural settings. So doing research in rural settings can often be more expensive because of the travel involved. And so then the tendency is to say, well, let's do it where, we have funding available, and that lands up maybe providing a little bit more of a limited picture, but that is often a reality. And sometimes deadlines in terms of particularly postgraduate research projects, where you're trying to kind of meet deadlines and trying to get a degree completed. Or I many years ago did quite a bit of work around program evaluation with NGOs, and then they've got their deadlines in terms of when they need information done. And so sometimes those deadlines can get in the way of kind of following the due process in terms of some of those quality criteria. Obviously, many logistical challenges, and we'll talk about COVID in more detail at a later point. That's made data, can make data collection tricky. In terms of getting hold of participants, often this can be really difficult. If we want to provide a balanced view of those who are positive and negative about something, sometimes the people who have maybe dropped out of a program are the hardest people to get hold of, even though their insights may be really, really helpful and help provide a more balanced perspective. We know in research, goalposts are often moved, sometimes by ourselves, sometimes by supervisors, sometimes by colleagues, but that is a reality as well. In terms of reflexivity, sometimes we don't always have the space given for that. Often for a postgraduate thesis, there's more space to write about this. For a journal article, if you're trying to fit into a word limit, that might be something that gets cut. And so there isn't always the word space, but sometimes even just the space in terms of someone to ask you questions about your role as a researcher. And that isn't necessarily always considered in the process. Also, what can get in the way of quality is just having limited opportunities to become familiar with the research context. And again, if I think of doing work in rural areas, I've done some work in various rural areas around South Africa, and you can kind of fly up and have some few meetings and whatever, but that understanding of the research context just comes after lots of time there and lots of contact with people in the context. And that really then helps you to to bring in the quality to your work, but also to think of, well, if I'm planning future work, what do I need to do to make sure it's quality? For many things, we learn these things as we go along, and we don't always have this like explicit theoretical training around these things, or necessarily the conceptual insight. And then in some instances, there are some contextual threats to ethics, and ethics is one of the things that's mentioned. And it makes it, not that we forces us to be unethical, but it just makes things not always fall into the neat little boxes that these criteria and checklists can sometimes imply. So just to go back to these big tent criteria. So I'll just talk through these very briefly and just finish off then with an example of how we've applied those. So the first is a worthy topic. So is this something that's relevant? Is it timely? Is it significant? Is it interesting? Is there rich rigor? Is there sufficient data collected? Is there an abundance of it? Is it appropriate? Are there complex theoretical constructs included? Linking to what I've just said earlier, is there data and time in the field? What does the sample look like? Is that rigorous? Do we understand the context? And then obviously doing data collection and analysis in a rigorous way is really important. So sincerity is the next criteria. So that involves self-reflexivity. And again, Nosipho will address that in more detail. Are we being transparent about methods and challenges, or are we just sugarcoating and making it all sound, it all ran smoothly as planned? Credibility. This refers to thick description, providing concrete detail, explication of tacit knowledge, showing rather than telling, triangulation or crystallization, multivocality, and member reflections. The criteria of resonance refers to how the researcher influences the aesthetic and evocative representation. Are they naturalistic generalizations, and are the findings transferable? Is this making a significant contribution, both conceptually or theoretically, practically, morally, methodologically, and heuristically? Is it ethical? And this is in terms of procedural, situational, and culturally specific, relational, and exiting ethics. And then lastly is meaningful coherence. So does this achieve what it purports to be about? Do the methods fit the stated goals? Does it interconnect with literature, the research questions, the findings, and interpretations? So I just want to run through this example as my last slide. So I work on something called the Healthy Life Trajectory Initiative, which is a study with young women and their children in Soweto and Johannesburg. And part of the study that I lead is the process evaluation. So there's a whole lot of outcomes that we measure, but we also collect a lot of qualitative data to help us understand how the trial is being implemented, what are the participants' experiences, what are the experiences of staff, the community health workers who deliver our intervention for us. And so there's been various things along the way that we've done to collect qualitative data to help us evaluate the implementation of this trial. So firstly, the worthy topic. We feel that this is a worthy topic. It's an intervention to optimize the physical and mental health of young women in Soweto and to positively impact the next generation. So the intervention starts pre-conception. If they fall pregnant, then we follow them through pregnancy and through into early childhood. And we feel, given the many challenges that young women and young children face in South Africa, we feel that this is something worthy of our attention. In terms of rich rigor, as much as possible, we use appropriate methods. Sometimes that's interviews, sometimes that's focus groups. We're looking at some of the other creative methods to really capture the richness of the data. We work with a small team to critique the interpretation and the presentation of findings. For some parts, we have a stakeholder group that helps us to guide some of that process. What we really try and do is to consider the context, particularly the home environment of these young women, and how that influences how they perceive the intervention, how they perceive what we're asking them in terms of behavior change to optimize their health. and the context plays a really strong role in influencing that. In terms of sincerity, as much as possible, we try and provide transparent descriptions of the methods of study, limitations and strengths. Again, this links back to all these moving goalposts that I mentioned earlier. What's important to us as researchers may not be important to our participants, and how we've had to learn to adapt and capture those perceptions so that we can be transparent about that. And that reflexivity is multi-layered. So it's, you know, within the team, I was saying we provide in-depth description of the themes, using concrete detail in the quotes to back that up. We also have been using a longitudinal approach for part of the process evaluation, which we feel provides some more of that thick description. And as I mentioned, we have a stakeholder advisory group for this longitudinal perspective to make sure that we're getting their input on the process. In terms of resonance, we use quotes to meaningfully represent participants' voices and experiences in a way that affects the reader, highlighting themes that are applicable to other similar South African settings. The significant contribution, we feel that the work in South Africa and in low middle income countries is novel, particularly in terms of process evaluation of an intervention like this. And it's applying this longitudinal approach, which is also novel for us and in South Africa, as far as we know, particularly for a trial like this. From an ethical point of view, we have the various appropriate approvals and informed consent from participants. And I guess one of the ethical issues here is that we obviously need to manage family dynamics and be careful about how we interact with the participants and their caregivers in terms of negotiating, say, access into the homes or sharing their perspectives. Lastly is meaningful coherence. So we try as much as possible to link these qualitative findings to what we're finding in the outcome evaluation in terms of quantitative findings. It also builds on formative qualitative work that was done before the trial and helps provide insights for future work. And that is it from me. This is the reference list, which we will share with you.
By virtue of definition, I think reflexivity is a concept that is associated with various qualitative research approaches and has been defined by various scholars. So I've put some of the definitions that are quite light from various scholars. So from Fuchs says that reflexivity is the ability to locate yourself in the picture, to understand and factor in how what you see is influenced by your own way of seeing. To be reflexive is to have an ongoing conversation about the experience while simultaneously living in the moment. Reflexivity is an attempt to place one's premises into question, to suspend the obvious, to listen to alternative framings of reality, and to grapple with the comparative outcomes of multiple standpoints. So in essence, reflexivity is understood as a process of continuous internal dialogue and critical self-evaluation of the researcher's positionality, as well as an active acknowledgement and explicit recognition of that, and an explicit recognition of how that position may affect the research process and outcome. Thus, reflexivity challenges the notion of knowledge production being independent of the researcher and the notion that research is objective. So I just want to juxtapose here the slight differences between reflection and reflexivity. And a lot of the scholars, some scholars tend to use these terms interchangeably. However, there are some slight differences. So reflection can be understood as thinking about something. So as a subject, I reflect on an object. And the process is a distanced one where that usually takes place in hindsight after the event has happened. So something happens and you take the time to reflect on what has happened, to see how you can do things better going forward. So we tend to use reflection as a process that we do in hindsight. However, reflexivity taps into a more immediate, continuing, dynamic, and subjective self-awareness. It is understanding that the researcher, the world, and the researcher's experience of the world are intertwined. So reflexivity is something that we do immediately. It's something that it's a sense of self-awareness that we engage in as we do research. So I'm going to now zoom in on the role of reflexivity in qualitative research. And it is widely accepted that reflexivity is a crucial part of the qualitative research process. However, there is a danger that reflexivity can just be a tick box in the exercise. And like Dr. Catherine has mentioned, that usually journals don't provide a lot of space for reflexivity. And so we find that it can be an exercise where the researcher just details their personal characteristics of race, class, and gender without taking the time to reflect on the meaning of these characteristics in relation to the research that they've conducted. And as qualitative researchers, we understand that our subjectivity is not a weakness in the research process, but rather a strength, and forms part of how we come to know about phenomena. And so our subjectivity is something that needs to be acknowledged. And reflexivity then gives us an opportunity to be clear about how we've positioned ourselves in relation to the research. It helps us to think about our personal experiences. And once we are conscious of these experiences, we then bracket them so that they don't unconsciously blind us to what we're currently studying. So this process enables us to do our best in foregrounding our participants' intended communication and not our own interpretation of the communication. So reflexivity helps us not to project our own experiences onto what our participants are saying, because we give ourselves an opportunity to reflect, to try and understand how we are feeling in relation to our research. And once we've given ourselves that opportunity and we've noted down those emotions, we are then able to create space and to eliminate what our participants are saying. So we understand that our behavior affects participants' responses, thereby influencing the direction of our findings. So meaning is negotiated between the researcher and the research. And so the research becomes a joint production of the participants and the researcher. So in order to ensure integrity and trustworthiness in our research, we don't deny or minimize our effect. We take the time to acknowledge how our personal characteristics such as gender, race, our affiliation, age, sexual orientation, our language, our beliefs, our theoretical and political ideological stances, we take all of these into consideration. And we look at how they impact our research process, from the questions that we choose to ask and those that we ignore, from whom we choose to study and whom we ignore, and the problem formulation, analysis, and write-up. So really, reflexivity is a process that takes place from the beginning of our research up to the end of our research. So now I'm just going to zoom in on reflexivity as an element of quality. And yes, Dr. Catherine has mentioned this, but I'm just going to sort of take a little bit of time on this and just to highlight the role of reflexivity in ensuring that we produce quality in qualitative research. So I am making reference to the article by Tracy. And in her article, Criteria for Excellent Qualitative Research, she refers to reflexivity as sincerity. So sincerity is one of the criteria that we saw on the checklist. And this alludes to the honesty and transparency required for good qualitative research. So that at minimum level, the transparency that most researchers acknowledge is that of their biases. However, we want to strive for a more intense level of transparency in our research, where we show how we've engaged with the process of reflexivity throughout our research process. So ideally, the process of reflexive analysis should start at the conception of the research idea. So the researcher needs to reflect on both the topic of the study and their own relationship to the topic, analyze their motivations, assumptions, and interests in the research, acknowledge forces that might skew the research in a particular direction by being open about what influences the decisions they make, the theoretical perspectives they've chosen, the methodological choices, and provide justification for these decisions. So it's important that in our research process, we keep a research journal in order to record field notes and reflexively analyze how we've come to our particular interpretations of our data. So transparency is marked by disclosure of our study challenges and unexpected twists and turns that we come across in our research, as well as revealing ways in which our research may have transformed over time. So really, in qualitative research, acknowledging everything that takes place, the good and the bad, that in itself, is contributes to quality and actually is a strength in qualitative research. So I'm just going to briefly go through this sort of practical application of reflexivity. And this is from Anna Wilkie. I quite liked the easy way in which reflexivity is sort of being made, it's sort of demonstrated on how we can make it practical, because I feel like sometimes reflexivity can feel like an abstract concept, and we sort of are not sure how to operationalize it in our research process. And so I found this quite helpful. So this focuses on when we are in the field. So you interview a participant, and during the interview process, you have to sort of become aware of how you were thinking and how you're feeling at the time. Acknowledge your baggage. Take the time to acknowledge your values, your assumptions, and how those can influence the findings. Take the time to reevaluate the findings and feed reflexive insights back into the next interview. So this just shows that reflexivity is something that we do as we do the research. We are constantly in a reflexive mode. So I just want to take the time to share a little bit around my own personal experiences with reflexivity as a researcher, and as a growing researcher in qualitative research, and how taking the time to think about reflexivity has sort of helped me to see how I've changed and grown as a researcher. So I started working in qualitative research in 2011 as a research assistant for an NGO doing HIV amongst high-risk populations. And I got an opportunity to do research with sex workers. And at this point, I wasn't sure how to feel about women selling sex. And I felt conflicted because of my personal beliefs at the time. So here I am, a young researcher, straight out of university, and getting this opportunity to work with female sex workers. And at the time, I'm not just coming into the field as, a researcher, but I'm bringing myself into the field. I'm bringing my own beliefs. I'm bringing my own ideologies, the way I've been socialized. And so there was a tension in me at the time. I was very unsure of this work that I was doing. I was very uncertain and uncomfortable. And this translated into the work that I was doing. Looking back, I realized that I was so conservative in the way in which I was asking questions, and in the way in which I was engaging with participants. And I did not have the space to talk about my conflicts that I was experiencing inside, because I'm working, I'm expected to produce data, to write up reports. So these were internal emotions that I was experiencing by myself, but not really having the time to express them, to debrief and work through them. And I feel like that was a disadvantage, and it held me back. And I do feel that it may have impacted on, the quality of the research that I produced at the time. And now fast forward to 2018, when I started my PhD, and I still got an opportunity to work with sex workers, and I had a completely different experience. There had been a lot of growth, and at the same time, the conflicts that I was experiencing earlier on, I had resolved them. All my personal conflicts and beliefs, they had been resolved somehow, and I was more aware of myself as opposed to all those years ago. And so I got into this opportunity to work with sex workers again, and I decided to approach the research differently. I decided to take my time into the field and really take the time to understand sex workers, who they are, where do they work, and how are they organized. And I attended, a lot of their meetings, a lot of their events, just really interacting quite closely. And this started to influence the way in which I was engaging with sex workers. And I really started to see them as experts of their lived experience. And I also wanted to relate to them less as participants and more as collaborators in the research process. And so in reflecting and taking the time to really understand how they are organized, listening to them, being vocal about their needs and how we can go about sort of dealing with some of the health challenges that they experience, it then influenced me to take a more participatory action approach to my research. So through reflexivity, I can say that I've been able to track my growth as a researcher over time, be aware of how my personal ideological changes have influenced the kind of research that I am today. And it's an ongoing process. As we grow, as we change, the way in which we approach research, particularly qualitative research, it grows and it changes with us. So in summary, reflexivity is a process of continuous internal dialogue and critical self-evaluation of the researcher's positionality. Reflexivity is crucial in qualitative research as it enables the researcher to acknowledge their subjectivity and how it impacts on the research process. Reflexivity must take place from the conception of the research problem right up to data analysis and write-up. And the level of sincerity and transparency of the researcher during the research process contributes to the quality of the research. So I think that's what I wanted to share this afternoon with regards to reflexivity. And here are some sources, and I'm sure Sonia will make these available. Thank you.